Dog privacy, hand hygiene. Hi, my name is Vern. I'll be your student nurse today. How are you? Good. And can I get your name and date of birth, please? Okay, thank you. And just to let you know, as the doctor ordered, I will be inserting your NG tube today down into your stomach. You may feel a little bit of discomfort. This should take about 10 minutes and involve a little bit of touching. Is that okay? Okay, great. Thank you. And before we get started, I do have a few questions. Do you have any allergies? And on a scale of 0 to 10, 0 being no pain and 10 being the worst pain, are you in any pain today? Okay, great. Thank you. So at this time, I will make sure that the bed is at hip height. I will have my patient placed in high Fowler's position with the side rail down on the right side since I'm working on this side. And for my supplies, I have my NG tube, I have a syringe, I have a tongue depressor, I have lubricant, I have my pen light, I have a rubber band attached to a safety pen, I have tape, and I already have prepped tape into a pair of pants just on the side of my table, and I have a pH paper for testing the gastric contents. And I also have an emesis basin and a glass of water with a straw. So at this time, I would ask my patient, have they experienced any nosebleeds? Have they had any nasal trauma or nasal surgery? And I would ask if they use anticoagulants. I will perform hand hygiene, don clean gloves, at this time I would also assess bowel sounds, and right now they are hypoactive, so I will be ready to insert the tubing. And I'm going to go ahead and remove the tubing from the wrapping. And before setting up my station, I just want to go ahead and measure the length of the tubing that I will need to be using. So to do this, I'll start at the bottom of the nose. Just going to hold it like that. I go up, around the ear, and I go down to the xiphoid process. And I'll make a note of this measurement, which is 50 centimeters, and you can tape it. However, I'm just going to make a note, a mental note of 50 centimeters so that no tape goes into my patient's nose. So I will now go ahead and place a towel around my patient. I will provide the emesis basin, and this is just for if you feel queasy during the insertion of the tube. I have water with a straw, and this is for during insertion of the tube, and while I'm doing that, I'll have you drink repeatedly. Okay, so now I will go ahead and attach the syringe to my tubing. I would remove this generally if I had a bigger syringe, however I don't, and I want it to be able to stay there, so I'm just going to keep this in place so that my syringe will stay on the tubing. And I'm just going to set that to the side. And then at this time, I would go ahead and assess the nares. I'm gonna have my patient lean back. I'm gonna shine my pen light. Okay, and I would have them breathe in, occluding one nair. Any difficulty? Okay, and then occlude the other one. Any difficulty? Okay, perfect. And I have decided I'm going to go ahead and insert the tubing into the right nostril. Both nares are patent. And I will now go ahead and lubricate the tip, about 1 to 2 inches of this, and I will do this generously. Okay. And at this time, I'm going to go ahead and place my hand on the back of the patient's head, have them tilt back just a little bit, insert from the bottom, going up, in, have them drink, 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 would have had them swallowed as well. And then after I advance it about 6 or 8 inches, I go ahead and lean them forward and advance it the rest of the way to 50 centimeters like I noted previously. Okay, and then throughout that whole procedure, they were drinking, drinking, drinking. And with my prepared tape in the pants, I'm gonna go ahead and attach the top part to the nose, like so. And then I will wrap one side around to secure it. And then I would wrap the other side around to secure that. And then I will go ahead and take my tongue depressor or pen light, and I would just look into the patient's mouth to make sure that there's no coiling around the tongue since they were gagging. I will go ahead and take out about 5 mLs of gastric contents. Go ahead and place that up so nothing leaks out. Place a drop onto the pH paper. I would compare this to my pH paper, which it is at a pH level of 3. I would reattach my syringe to replace the gastric contents. I would take it off. I would drop 20 mLs of air to irrigate the tube. Place that on. Push in the 20 mLs of air. I will now attach this end onto here so that nothing leaks out. I can remove the emesis basin and the water. And I have my rubber band with the safety pin. So I'll go ahead and wrap this around like so. And I want to place this in a position where it's high enough to where others can see it, that it's pinned on, and I'm just going to demonstrate using the towel as the gown. However, typically you'd want to remove the towel and then secure it to the patient's gown on the top. And I want to do this to where they have enough room to move comfortably in bed as well. Okay, so I attached that patient's gown. I would discard my gloves, discard my trash, perform hand hygiene, and at this time I would send them down for an x-ray to ensure the placement. Okay, I'm now at the portion where I'm going to remove the NG tube from my patient's stomach. So I would knock knock, provide privacy, hand hygiene. Hi, my name is Bert. I'll be your student nurse today. How are you? Okay, good. And just to let you know, today I will be removing the tube from your stomach as the doctor ordered. This should take about a minute and involve a little bit of touching. Is that okay? Okay, thank you. And before we begin, do you have any allergies? And on a scale of 0 to 10, 0 being no pain and 10 being the worst pain, are you in any pain today? Okay, great, thank you. And so at this time, my patient is already in high Fowler's position. The rail is down on the side that I'm working on, the right side, and the bed is at hip height. I will perform hand hygiene and don clean gloves. I'm going to go ahead and remove the tubing from the patient's gown. And I will now go ahead and detach this portion, holding it upright so no gastric contents come out. I will irrigate this with 20 mLs of air to make sure that if there is anything, that it goes down into the stomach. Okay, so irrigating that with 20 mLs of air. At this time, I'm going to go ahead and remove the tape from my patient's nose and the tubing. Holding it in place while I'm taking the tape off. Since I am removing the tubing, I decided to not check the placement. However, it is still necessary to irrigate the tubing with 20 mLs of air. I do have an extra towel here just so that nothing drips onto the patient. I would tell my patient to hold their breath for a few seconds, and then in a continuous motion, I would remove in 1, 2, 3. Checking the tip to make sure that no remnants are not intact. And on this tubing, everything is intact. I would then discard my trash, remove the towel from my patient, lift the side rail up, lower the patient back down into a comfortable position, make sure that the bed is low with the brakes on. I would ask if they have any further questions prior to providing the call light. I would remove my gloves, discard them, perform hand hygiene, and thank you.